Welcome back to Psych Waves, where we review emerging and current holistic treatments in psychiatry while learning to better understand the workings of our own minds. I'm your host, Dr. Teresa Anderson, owner and practicing psychiatrist of the Anderson Clinic in Cincinnati, Ohio, where we specialize in treatment-resistant depression, anxiety, PTSD, and concussions. Today, we're actually diving into that topic that is far more common and complex than many people realize: the concussion. It's often called an invisible injury, and for good reason. Unlike the broken bone, you can't see the damage, but its effects on the brain and mental health can be profound. We'll be covering what a concussion actually is, how to spot the signs, what puts you at risk, and the long-term consequences. Of course, we'll also discuss how an emerging treatment, PRTMS, can offer hope for recovery. So let's start by breaking down the basics. What is a concussion? A concussion is a type of traumatic brain injury, or TBI, caused by a jolt, blow, or bump to the head. And it actually doesn't even require necessarily a direct blow to the head, but can happen, for instance, if you're traveling in a car and going from 60 miles per hour to 0 in an instant. It can also happen from a sudden whiplash-like movement that causes your head to move rapidly back and forth. This rapid movement causes the brain to slosh around inside the skull, leading to a temporary disruption of normal brain function. Your brain's consistency, from a physical perspective, is actually much like that of unset Jell-O, believe it or not. Any rapid or jarring incident can cause disruption, despite it being bathed in a cushioning liquid, your cerebrospinal fluid, or CSF. If you think of your brain like a computer, a concussion is like a sudden power surge that causes the system to reboot, but not quite correctly, back to its standard baseline. It doesn't mean that there's bleeding or structural damage in most cases, but rather a metabolic and chemical cascade that throws the brain's delicate systems out of balance. Because the injury is to the brain, the symptoms are wide-ranging and can affect your physical, emotional, and cognitive well-being. It's crucial to be able to recognize the symptoms in yourself and in others. So the physical symptoms can be headache or feeling of pressure in the head, nausea or vomiting, dizziness or problems with balance, blurry vision or sensitivity to light and noise, almost like that of a migraine, feeling sluggish, hazy, or foggy. The cognitive symptoms include difficulty with concentration or memory, feeling slowed down, having trouble thinking clearly, or being overwhelmed easily. The emotional symptoms include irritability or sadness, anxiety or nervousness, or being more emotional than usual. And these can come up whether or not you've had a mental health history. It's important to remember that these symptoms can appear immediately after the blow to the head, after the injury, or develop even over the course of the next few hours or even days. If you suspect you or someone you know has sustained a concussion, please seek medical attention immediately, as any blow to the head, with or without loss of consciousness, should have medical imaging to rule out a brain bleed, which can be a life-threatening condition. So, what activities put you at risk? Concussions are commonly associated with contact sports like football, soccer, hockey, but you don't even have to be a professional athlete to be at risk. Everyday activities can lead to concussions, including but not limited to falls, especially in older adults and young children. Car accidents, obviously when we talked about whiplash, bicycle or motorcycle accidents, skiing, snowmobiling, or snowboarding accidents, even something as simple as a fall in the kitchen where you hit your head. The key is any activity that involves a blow to the head or sudden forceful movement that shakes the brain. Now let's talk about the long-term effects of a single concussion versus multiple concussions. For many, a single concussion resolves on its own within days or weeks with proper rest. But for a significant blow to the head, about 10 to 20% of the time, symptoms can persist for months or even years. We call this post-concussion syndrome. The symptoms I mentioned earlier: headaches, dizziness, changes in your vision, anxiety, trouble with concentration, they just don't go away. This can significantly impact a person's quality of life and ability to work, study, or enjoy social activities. I can't tell you the number of people that have come to me in their 40s swearing up and down they have ADHD because they can't pay attention and they can't multitask, but all these symptoms suddenly occurred after a motor vehicle accident. Now, when you sustain multiple concussions, the risks and consequences increase dramatically. Each subsequent concussion can make the brain more vulnerable and the symptoms more severe and longer lasting than the prior one. This is where we see a higher risk for CTE, or chronic traumatic encephalopathy. It used to be called dementia pugilistica, or pugilist disease, fighting. I believe this is part of what Muhammad Ali suffered from. We're talking about long-term problems with memory, judgment, impulse control, depression and mood swings, and even Parkinsonian-like symptoms of movement. It's a very serious concern, especially for athletes. I truly believe this is one of the most widely underdiagnosed problems we are facing. In my 16 years of practice, over 90% of the people who we had labeled with treatment-resistant depression, when given an EEG, showed signs of an old or multiple healing concussions. And part of the issue is that you may not have had mental health struggles prior to receiving a blow to the head, and then all of a sudden you can't think clearly, you're easily overwhelmed, you're anxious, you're depressed, or you can't sleep well. And if you did carry a mental health diagnosis prior to your concussion, they can worsen all of these problems. So given these serious potential outcomes, where does that leave us for those who are still struggling with the symptoms? That's where my practice's specialty comes in, and I want to introduce you to a promising treatment that we've discussed in previous podcasts, PRTMS, or personalized repetitive transcranial magnetic stimulation. I know, it's a mouthful. Traditional treatments for concussions often focus on symptom management. We might use medication for headaches, or glasses for vision changes, or therapy for anxiety. We could tell patients to stay in a dark room with little to no light or sound stimulation, or nix the video screens. But for how long? I mean, that may keep you from having a headache right now, or keep your ears from ringing for a few days, or keep you from having double vision with prisms in your lenses, but you can't continue living that way. PRTMS takes a very different approach. It uses magnetic pulses to stimulate specific underactive areas of the brain that were injured by the concussion. And how do we figure out what parts of your brain are underactive? We actually perform an EEG when you first come in, then on a weekly basis after that to monitor for signs of improvement. We use advanced brain mapping to pinpoint exactly where the dysfunction is, allowing us to create a truly personalized treatment plan for each patient, because each brain is different. Standard TMS delivers treatment at one site, at one amplitude, at a one-size-fits-all treatment. PRTMS hones into where your brain needs the most help, and every single one of us has a different computer processing speed. So if we hone in on your personal healthy speed, we can amplify it. Think of it like this. The concussion creates misfiring circuits in your brain's electrical system. Much like when you're a runner and you tweak your knee, until it heals properly, you cannot run as fast as you once did, right? PRTMS is a highly targeted and non-invasive way to use a magnetic field to essentially rewire those specific areas, restoring healthy brain function, allowing it to fire at your brain's innate healthy speed. I've never run a 4-minute mile. I will never be able to run a 4-minute mile, but if I could run a 6-minute mile, it might get you back to running that 6-minute mile. You know what I mean? So for many of my patients, PRTMS has been life-changing. It's alleviating the stubborn headaches, the brain fog, and the emotional distress that lingered for sometimes years after their original head injury. So what's my final takeaway? A concussion is not just a minor bump on the head. It's a serious brain injury that demands attention, and if symptoms persist, specialized care. If you or a loved one is struggling with persistent symptoms from a concussion, don't just live with it. Don't let your symptoms become your new normal. You deserve to feel like yourself again. I encourage you to seek out a professional who understands the complexities of traumatic brain injury. You can learn more about concussions, PRTMS, and other cutting-edge therapies on my website, www.andersonclinic.net, or by scheduling a consultation at my practice. Thank you, as always, for tuning in to Psych Waves, and until next time, be safe and take care of your most valuable and irreplaceable asset, your noggin. If you found this information helpful, please like, subscribe, and follow us. Tell your friends. You can find us on Apple and Spotify. You can stalk us on Instagram or TikTok at Anderson Clinic Cincy with a Y. And if you happen to be in the Cincinnati area and looking for assistance with treatment-resistant depression, anxiety, PTSD, or concussions, give us a call at 513-321-1753. Start feeling better faster.